We are giving superior laryngeal block on the right side. So the assistant presses the head bone on the left side so that it becomes more prominent and we can give the block. So we have to hit the greater corner of the head bone, then pass it inferiorly and pierce the thyroid membrane. As soon as we pierce the thyroid membrane, we can feel a loss of resistance or pop-up feeling. Here we have to give 2 to 3 ml of 1% lignocaine, and this procedure is repeated on the opposite side. So when we have to repeat on the opposite side, same the assistant will press on the hyoid bone on the right side so that left side it becomes more prominent. We can palpate this hyoid bone, the greater corner is palpated and the procedure is repeated. In order to appreciate this loss of resistance while piercing the thyroid membrane, we have to blunt the needle. So we can blunt the needle by scratching it on the cup, on a sterile cup 1 or 2 times. Then it becomes blunt and we can appreciate this loss of resistance better. We have to aspirate for any air or blood. If air is coming means then it is inside the cavity. So then we have to withdraw the needle a little bit. After the superior laryngeal nerve block is done on bilateral, now we have to go for transtracheal injection. For transtracheal injection, here we have to insert the needle in the cricothyroid membrane. So we have to aspirate for air. So this aspiration for air, air is coming. It is in the trachea. Now we have to inject around 2 ml of 4% lignocaine transtracheally. So here you can see there is air is coming. We have to give 2 ml of 4% lignocaine. As soon as we give, then the patient coughs. If the patient doesn't cough, then you make the patient cough voluntarily. Now we have to, in this patient, this nose is prepared with 4% lignocaine. That is, the cotton pledgets are soaked in 4% lignocaine and are placed in the nostril. Now we are doing this blind nasal intubation. So after passing the ET tube, we have to hear for the breath sounds. At the first attempt, the tube is going into the esophagus, and I am trying for the second time also. Second time also it is going into the esophagus only. So I am not able to hear the breath sounds after a certain point of time. Here now what I am going to do is I am inflating the cuff. By inflating the cuff with around 10 to 15 ml, the tip of the tube it goes more anteriorly, a little bit anteriorly. Now I am passing the ET tube. So when this tip goes a little bit anteriorly, it enters the glottis. After the tube is inserted for say around 23 or 22, 23 centimeters, then we have to deflate the cuff. So we have to deflate the cuff and we have to insert the tube into the trachea. So continuously we have to hear